morning, everybody. Welcome to our resource refresher webinar, jointly led by the National Centre for Family Hubs and Foundations. It's wonderful to have you here. If we go to the next slide, please. So I'd just like to begin by introducing myself. My name is Huma Huq. I'm the Evidence and Implementation Lead at the National Centre for Family Hubs, and I will be one of your hosts today. So just a little bit of housekeeping. The webinar will be recorded today. We may finish early and questions are welcome. In the chat, we have added some instructions to use the Q&A feature, so please do that. And we'll also have some time for comfort breaks. We just have the agenda up here, so we'll begin with our introductions. Then I'll be handing over to Joan Flanagan from Foundations, and then I'll be talking to you about the National Centre for Family Hubs, as well as upcoming induction sessions, our implementation toolkit, our case study library, and there'll be plenty of time for question and answers also. Jo, would you like to introduce yourself?
Good morning, everyone. My name's Jo Flanagan, and I'm a Senior Local Development Advisor at Foundations.
Lovely. Okay, so I think I'll just begin by handing over to you.
Thank you. Next slide, please. Okay, so I'm here today to talk to you a little bit about some of the resources that we've been developing over at Foundations, formerly the EIF, formerly the What Works for Early Intervention in Children's Social Care. Foundations is definitely our final resting place for a name. We've been developing some resources for family hubs around the family hub development process, and I'm also going to talk to you a little bit more at the end of the session about some of our already published resources for the reducing parental conflict. So next slide, please. So I'm just going to tell you a bit about some of the work that we've been doing with 15 local authorities in the last 6 to 8 months. So this is a project where we've been aiming to develop some evidence-based resources to support the family hub development process. And it's had several strands to it. So we've had 15 local authorities that have been helping us with the application. And then we've also been developing 5 applied resources. The final versions will be available in September 2023. We've been supporting local areas with via our local development team to help them to embed those resources into their bespoke contexts. And then we're also in the process of developing some evidence summaries, which will be specifically around the 4 funded areas in early years. And we've been also providing additional support in the form of webinars. So we've had webinars that the 15 areas have been able to attend to hear more about the applied resources. And we've also run webinars for data leads in each of the local areas who can hear a little bit more about the application of the data, particularly around the needs assessment work, which I'll talk to you about in a little bit more detail shortly. So next slide, please. So what do we mean by evidence? So each of the resources have sort of drawn on this model of support. So I guess when we think about evidence, people automatically think about scientific research, which of course is an important element around when you're thinking about using evidence, but there are a whole host of other things to consider in a local area if you're going to be thinking about your own local context and the evidence available. So we would also suggest looking at the monitoring and evaluation data that you collect, any other organizational data, for example, about how resources are used, workforce knowledge and skills. You might think about referral pathways or waiting times in services. Another element that you might want to consider would be your population data. And typically in a council, that information, the confidence using that information would be more with the data leads and in your public health services. But what we've been thinking about in this project is how we can bring all of those people together to combine the shared intelligence within a council or a local area, so that we can have a true picture of what's happening, and so that when the family hubs are developed, the response is bespoke to the needs of specific areas where the family hubs are going to be sited. Another element that's important to consider is lived experience. So talking to families and children and young people as well to seek their views, which sometimes gives you very different information to the data that you might collect from your population data. So it's a really important element to consider. And then finally, professional knowledge. So this is what your practitioners know out there working in the field. So what do they know about, the specific nature of certain parts of a local area or localities, and how then that can be used in terms of helping you to fully understand your local context. So next slide, please. So the first resource we developed was a population needs assessment resource. You can find this actually on the UNICEF toolkit. There's a link there at the top to find it if you wanted to have a look. I should say that each of these resources are beta at the moment, as you can see here, and we are planning to refine them now after we've sort of completed this piece of work and learned more about how the tools have been applied. So we will be updating them. The population needs assessment has got a very sort of specific step-by-step approach to it, which helps you to plan the process for carrying out a needs assessment. And it also draws on data that helps you to understand the risk factors for children in your local area in the early years and for the older age range, and helps you to think about what that means for child development and early years in your local area. Next slide, please. The second resource is a system assessment. So this is a tool that helps a local area to look at their local system and think about, which partners are available in the local area and how they come together and work together as a partnership. We do draw on some of our tools and other tools that are available that can be used to support this process as well, such as the maternity and early years maturity matrix and the early help systems guide, which you may be familiar with already. Next slide, please. The third resource is a workforce assessment, and we've been developing this tool in conjunction with colleagues in the local government association. So we've been working with them with an individual there who has a lot of expertise in this area. And the local areas have just started to test this out in some places. So it looks at the sort of how you set the priorities, roles and responsibilities and the resources that are needed if you're going to look at the workforce around your family hub, how to carry out a workforce needs assessment, how to develop a multi-agency workforce plan, delivering multi-agency workforce development, and then how you can measure your success to see whether it's been effective. So this is a tool that several areas are testing out right now, and we're really interested to hear the feedback to see how it's working. Next slide, please. The fourth resource is about child and family engagement. So this is a tool that you could draw on. It's more theoretical, I guess, but it helps you to think about the different ways that you can engage with children and families. And it goes through the different methods, such as how you can collect feedback, how you can consult with children and families, and how you can go to sort of the next tier up, which is looking at co-creation with families. And some of the areas that I've been working with have been using the feedback element particularly a lot at the moment, just to get that feedback about the opening of the family hubs and get family views, and with a view to finding families that they could work with in more detail in their parent carer panels, with a view to using a more co-creation approach with those people once found. So that's a really useful resource too. Next slide, please. And then the fifth resource is about mapping child and family services. So this is thinking about, what does this mean? It's thinking about the services that are available in your area, or it might be the interventions that are available in your area, any courses that are available there for families, therapy, advice and information. And it's about how you might map all that together and think about what that looks like. And you might map it in lots of different ways. So you might think about it in relation to the 4 funded areas, or you might want to think about it in terms of, you know, the triangle, universal, targeted, or specialist services. And it helps you to think about what you've got available and where the gaps are. So once you've done your needs assessment, you thought about your workforce, this is going to help you to think about, well, what do we need to add into our recipe when developing a family hub? So that we have an offer that's going to meet the needs of our local population. So these tools have been developed really to support the process that you've all been going through when developing your family hubs. It's run parallel to the process that you've been working on with the DFE, but it's kind of sort of fleshed out each of those steps so that each local area can look at these bits of the system in more detail, blow them up a lot more, and reflect in a lot more detail about how they're using their local resources to be able to provide the new offer for the new family hubs. So next slide, please. So we've also got several published resources which are available. I don't know whether any of you are familiar with the Reducing Parental Conflict resources. You've more than likely got a local lead in your area who takes responsibility for the Reducing Parental Conflict program. So I'm just going to run through some of the resources which are available for you to use around RPC. There are links on this slide, so if you've got access to the links, you'll be able to see these resources and use them as you need at the moment. So just having a look now, next slide. So the first resource is a short guide for helping you to set up your RPC offer within Family Hub. So we've really now been trying to align our RPC resources to Family Hubs, because increasingly it's becoming part and parcel of the offer in local areas. So there's a short guide there that you can have a look at and have a read through. And then we've got a step-by-step guide for conducting a needs assessment on parental conflict. So this follows a very similar pattern to the needs assessment tool that we've developed for Family Hubs. And there's a template there that you can use as well to sort of collate your findings. So it's used to help you think about your needs assessment guidance, your RPC risk factors, and think about what that means for the offer that you're going to develop around RPC in your own local family hub. And then we've got another tool, which is a tool that supports you to develop a support pathway around your offer for RPC and how you can communicate that to others. It includes information about how you can develop that in an outreach manner and how you can communicate it to all staff and parents. And it also includes features about how you can develop this offer with digital means as well. And then we've also got a guide here, which is about how you can evaluate your training. So if you're putting on training for practitioners in your local area around reducing parental conflict, this tool's been developed to help you to evaluate that training. And it's a sort of step-by-step that you can use when evaluating to look to see how effective and it's been and the impact that it's had on children and families. And then finally is the Reducing Parental Conflict Outcomes Framework Guide. So this is an outcomes framework that we developed sort of last year. And it sort of goes through in detail how the evaluation and impact training can be incorporated into the outcome measurement, and how you can use this to support interventions more widely in family hubs. So that's our Reducing Parental Conflict offer. Has anybody got any questions that they'd like to ask me about the resources that we've got available?
It looks as though we have a question.
Okay, thanks, Huma.
Will the slides be sent out after?
Yes, they will be sent out after, so you'll be able to access the links to the RPC tools that way. The other tools are beta resources, but if you would like to have a look at them, we can release them for you to have a look at, but it's with the caveat that they might be adapted and changed because we're in the process of reviewing them at the moment. Has the RPC training been evaluated? Yes, we did some evaluation work last year, looking at with some local areas that we were testing it with, and we helped them go through a process to evaluate their training, and the guidance shows you how to do that. So we did use the evaluations from that local area work. Can we see the results of the evaluation you conducted? Becky, do we have that information available to share? Did we write it up? Do we know?
The RPC work?
Mm-hmm.
The case studies might be a place to read something about how local areas found implementing the resources. But I'm not sure about the wider, but we can certainly check if somebody wants to leave their email, and we can get back to you.
On our website, we have a case study map. So you'll be able to read some of the case studies around reducing parental conflict with areas that we've worked with in the last 12 to 18 months on there. So if you go on our website, the old EIF website, you can get that through through a link in the Foundation's website. Henny, will the assessments be collated centrally to create a picture of England? That's what we're attempting to do with the case study map. So as we work with more local areas, case studies are collated and we're adding them to the case study map. In fact, I had a meeting about that yesterday. I know there's a lot more case studies to go on the map now. We're just in the process of looking how we can do that from an IT perspective. So that's the place to go and have a look to hear about the local area evaluations. Mary, I'm more interested in whether the learning is sustained by parents. Does RPC work sustain improvement over the long term? I guess that will be what you would have to have a look at in the case studies. I don't think we've done any particular work longitudinally to look at the outcomes of the RPC work, but the program is continuing for the next couple of years, and we will be collecting more data and information as time goes on. Sandra, what progress has been made on mapping across the country? Do you mean with the reducing parental conflict, Sandra? That work is still currently underway, and I know we have a lot of case studies to share. Looking at we've got quite a wide reach now across the country with RPC. Know the available community assets. That isn't something that we would have done ourselves personally. That would be something that the local areas would have done as part of their mapping work. We haven't collected that information centrally as far as I'm aware. Any other questions? Any questions about the wider Family Hub resources? So Sandra, you say that there's no funding. Is this for the reducing parental conflict work or for your Family Hubs work? For hubs. So so you're not one of the funded areas. Can I put the link to the resources in the chat? Yeah, we can sort that out for you. Or you can have them, or you can have the slides where you'll be able to find the links.
Thank you so much, Jo. If there are any further questions, please do put them in the chat. We're more than happy to answer them. And there'll be a section at the end for us to answer questions also. Okay, lovely. Is it okay if I move on to the National Centre for Family Hubs, Jo? This is a little bit of a whistle-stop tour about NCFH and Anna Freud. So if I could just have the next slide. So the National Centre for Family Hubs, actually, we're hosted by Anna Freud, and we sit within Anna Freud's Early Years Intervention Department. So as you know, we're a national learning platform which supports local areas in England to design and develop family hubs so that babies, children and family children and their families can access the joined up whole family and inclusive support they need to thrive. And we're funded by the Department of Education, and our evidence partner is Foundations, who we just heard from just now. Our work is informed by 3 areas, and that's evidence informed. So we aim to be evidence informed. So we use a mixed method approach to evidence and policy synthesis, and we work closely with our evidence partners, Foundations, to generate and test new evidence and ensure that we're delivering the best practice. We're also practice-based, so we work with local authorities, regional communities, and other stakeholders to ensure our learning is informed by local practice and case study development. And this complements our regional support work, which draws on the application of mentalization to practice, which I will touch on shortly. And we're also participation-led. So our work is underpinned by the Lundy model. It's a rights-based participation model, and our paid participation advisors are involved in national forums, and they work with local authorities to gather insights into participation. And there should be a link coming through for the Lundy model in the chat shortly. So I'd just like to talk about mentalization next. So as I've said, NCFH sits within the Early Years and Prevention Department, and that's part of Anna Freud's clinical division. So our work is informed by mentalization, which is a concept rooted in attachment theory. Mentalizing is a human capacity for making sense of oneself and others by imagining what might be going on for someone underneath the surface. And we can mentalize at an individual level. So perhaps when you're having a conversation with someone or a group setting, as well as a systemic level. So this means that as well as informing our direct work with families, mentalization is helpful in supporting multi-agency teams to work together in complex networks. This is particularly useful in the landscape that we operate in. A core component of mentalizing is cultivating trust through relationships, so that individuals and teams can create cultures of reflection, learning, and adaptation. So, as I mentioned, we are in a particularly complex policy and practice landscape where the workforce may be struggling with fatigue and burnout. So hopefully through applying mentalizing at the systemic level, we can support. Next slide, please. So NCFH isn't a clinical service, but we do touch upon those 3 core aspects that I mentioned, so attachment, mentalizing, and trust. And we do this through practical application through AMBIT, which is adaptive mentalization-based integrative treatment. So ultimately, we want to support local authorities and families through using this. Next slide, please. Okay, lovely. So now I'd like to talk to you a little bit about our upcoming induction sessions. So as you may know, within our team at NCFH, we have a number of regional implementation advisors. So an idea that's come from local authorities is to have induction sessions for new starters, and this is to complement their induction to the local authority also. And what we hope to do through this training session, so it'll be a monthly session, probably for about 45 minutes, and we will introduce who we are. So we'll have a regional implementation advisor delivering the training. We'll talk about what we do, how we can help, and our role within the wider context of Anna Freud and the funding landscape. We'll go through resources such as the toolkit, which I'm going to talk about shortly, case studies, as well as our resource library. And we'll also go through the different type of support that we can offer local authorities. So we do have a number of events. We have webinars such as this. We also have communities of practice, and these can be regional, or they can also be themed. So it's open to lots of different local authorities. And we also have other events like Share and Learns, And we also have a Teams platform, which we're fairly active on. Okay, lovely. Next slide, please. So I'll next be talking to you about our implementation toolkit, which I'm sure some of you are familiar with. Next slide, please. So this is a screenshot of the implementation toolkit, which is on our website. Links will be circulated. And we have a number of modules that can support the implementation of family hubs in local areas. So if we could just go to the next slide. So the implementation toolkit is a collection of resources designed to support local authorities in setting up their family hubs. So we have a series of modules intended to spotlight specific topics, and these are informed by local authority need. And it's not a finalized resource. These resources are constantly being updated. If you could go to the next slide. Recently, we actually did update a number of modules, and we're actually in the process of writing some more as well. We also have a summary guide, which I would urge you to have a look at. It's roughly 20 pages, and it really does set the scene for the National Centre for Family Hubs. It provides an overview of all the modules. It's a good place to start when thinking about how to use the toolkit, and it helps readers to understand how the modules are linked. Next slide, please. In terms of using the toolkit, the modules are organised into 4 sections. So we have background information, strategic golden threads, practice approach, and ingredients for successful implementation. And they're broken into these different sections to support the family hub journey in different local authorities, depending on what stage you're at. So several modules are actually still in development, and they should be published by the end of the year. So these are children's social care, schools, voluntary community sector and faith, data sharing, spaces and co-location, virtual and digital delivery, workforce and peer support. So we have had a few huddles where we've asked for local authority input, and we are raising them also in our communities of practice. What I'd like to do now is actually spotlight 2 modules. So the first module is a module that would be useful at the beginning of a local authority's journey. So this is the family hub development process. And as I said, this would be useful for local authorities just beginning their family hubs journey, as well as for new team members who may benefit from a better understanding of what might have already happened before they join the team. And the module outlines building consensus on the need for change, using local data to understand current need and provision, developing a family hub approach by agreeing on a shared understanding of the model and the partnership it will take, planning implementation by assessing the readiness of the partnership to implement the family model. So that's a great module if you're at the beginning of your journey, and we will have a link for that also. Okay, lovely. Next slide, please. Another area that would be useful, perhaps further along the family hub journey, is the special educational needs and disabilities module. So this is to ensure that provision for children with special educational needs is embedded in their offer. This module aims to raise awareness of key issues impacting on families with 1 or more children with the SEND need. It aims to inform about the statutory responsibilities and guidance related to SEND, advise on data, strategies and good practice, as well as supporting planning, the doing and reviewing for the inclusion of families with 1 or more children with SEND needs. And it also makes the case that SEND should be built into the family hub development, not bolted on. So this is something that you may have come across from one of our regional advisors, Julie Greer, who's also our SEND lead. And she always says, not bolted on, built in. So that's something that in the team we're all very familiar with. I also see that there are a few questions, and I wonder if it'd be a good moment to... they're the links. Okay, lovely. Next slide, please. So as I touched upon earlier, we do have a number of modules that are in development. So we're hoping to publish these modules by the end of the year. So we have 8 modules, and we're keen to develop each module in collaboration with local authorities to ensure that they're valuable to you. And we have, as I said, touched upon this through communities of practice and one-to-one discussions. But if there is a module that you'd really like to input into, please do get in touch with Anna Bradford or Erica Roscoe, who are leading on these modules, and they're both regional implementation advisors. The slides will be circulated, so you'll have access to their emails also. Okay, lovely. Next slide, please. So in terms of support for local authorities, we have lots of other ways to support in addition to the toolkit. So we have national webinars such as this one. We have a list on the website where you can sign up, and there's also access to previous recordings. We have a Family Hubs online network. So this is a Teams channel where you can share knowledge, resources, and network with other local authorities. If you'd like to sign up, please do get in touch with NCFH inquiries. We also have regional support, and this is through our regional advisory team. So we have, I believe, 5 regional advisors who work across the 9 regions, and they're able to provide you with one-to-one support or signpost you to another individual. And we also facilitate a number of community of practices and other events such as Share and Learns and Lunch and Learns. There's also the offer of one-to-one support. So this can be an ad hoc meeting or a series of meetings. Could also facilitate a workshop. But we also do have a consultancy offer. So this is where you may need more intensive support, and we need to develop a more bespoke offer. And again, please do get in touch with NCFH inquiries if you're interested. Okay, if there are any questions about the toolkit, I'm more than happy to answer. In that case, I'll move on to the case study library. So again, we have this resource on the website. We have a number of case studies, and we are updating them on a quarterly basis. And these are generally created through conversations that we've had with local authorities or other organisations where we want to highlight good practice. Next slide, please. So just a quick run through of why we use case studies. Case studies showcase innovative and creative practice across local government, community, voluntary and faith sectors. It puts practice into context, highlighting the challenges and successes. It also links the NCFH toolkit and other resources that are available, and it supports the development of family hubs across the country. Next slide, please. So this is our triangle, our golden triangle. So we do again try to make sure that everything that we do is participation-led, evidence-formed and practice-based. So in terms of participation-led, we ensure that we are listening to children, young people and their families, and hearing from local authorities, the voluntary and faith community. We ensure that we are evidence-informed. So what was the impact? How were challenges overcome? And we also ensure that we are practice-based. So family hub development in context, supporting LAs and other organisations to develop their practice. Next slide, please. So here are some areas in which we have topics of case studies. So we have participation, governance, outcomes and evaluation, theory of change, peer support, leadership and integration. So if there are any topics under those areas, we're more than happy to cover them. Next slide, please. We'd just like to highlight one of our case studies. So this is Durham's Father Inclusive Practice. So following community engagement, we found that only 4% of male carers responded to a survey. So Durham decided to change the narrative across the whole organisation, not just as part of family hub development. Workforce training took place,
So they no longer had the view that dads are not engaging. It's our job to ensure that our service is more accessible to dads, and the onus needs to be on us as a workforce. So more dads engaged in the empowering parents, empowering communities training, and now some dads are signed up to deliver the programme. One of the dads actually said, the reason I work with Sue is because she doesn't judge me. She didn't just come straight in and start and tell me what to do and start going on about what parenting my son needs. She didn't make me feel as though it was my fault. I didn't feel blamed or embarrassed. I felt understood, like I could be myself. She's helping me with stuff I wouldn't have a clue about, that nobody else has done. So this programme was very, very important. And I also feel that the approach that Durham took resulted in positive results. Please do take some time to have a look at our case study library, particularly this case study. Next slide, please. So in terms of case study content, we're always on the lookout for new case studies to highlight practice. And this is something that our regional implementation advisors lead on. So if there's any area of good practice, wider context, perhaps why practice was developed, who was consulted, what happened, what was the impact, how were challenges overcome, these will all be the questions that we'll be asking you in the process of creating a case study. And this is very much supported. It's not just sent to you, we can make it quite collaborative, perhaps have a meeting where we'll work with your local authority and we'll note down these answers to these questions through a conversation, and we'll write the case study up and then send it off to you to review. And then after responding to your comments, we'll update the website with the case study. Next slide, please. So if you have got an idea for a case study, please do get in touch. Again, Anna and Erica, who are regional implementation advisors, are leading on the case studies. So just if there's an idea, please speak to your colleagues, everybody's involved, to make sure that we have permission to share, and do agree consent from children, young people and their families. Otherwise, we're really happy to take on any case study and highlight best practice. Next slide, please. Okay, so we've actually come to the end of our presentation. Are there any questions that you would like to share? More than happy to answer any. Okay, thank you, Tracy. So your question is, when you talk about the support for LAs, does this include the wider sector, as many services are also delivered by the VCS sector? So the support that we offer is generally for local authorities, but we do understand that the community, voluntary, faith sector are so essential to everything that is done in local authorities. But at this point, we are targeting local authorities as opposed to directly voluntary and community and faith sector. We did previously have a faith working group, which was very interesting. I understand that there's really an appetite within the voluntary and faith community to engage, and they know their community so well. But at this present moment, we are focusing on LAs. I should just add that we are also in the process of writing a module. So any views or any feedback on how we could, or local authorities are working with the voluntary and faith community would be brilliant. If you could put us in touch with VCS organisations, that would be helpful to also have their feedback. We are working with Bernardo's and NSPCC at the moment. But Sandra, that would be brilliant if you could just connect us with anybody. Okay, lovely. Thank you, Penny. We have found that delivering training to LAs and their system partners, including VCSC, has far stronger impact and will role model what LAs are looking for in practice when delivering family hubs. Yes, definitely. That's not something that I'm surprised by, to be honest. I think the VCS e-community is incredible, and they again know their local authority, their communities so well.
I think what we found in our work is that particularly in the engaging families work that we've been doing in the project, local areas, and when I say local areas, I don't mean local authorities, I mean local area partnerships are seem to be working very closely with their VCS partners, especially around the parental engagement work. So from the small amount of insight I have from working with local areas and the work that we've done, I do see that the VCS sector is valued and equally important in the development of this offer. I think we do have our email contact details, don't we, Huma? Have we got them on a slide that we can share with everybody? I was just thinking, if you do have any further questions about the resources from foundations, please do email me directly. I might be able to deal with your questions a bit more specifically and talk to colleagues in the other teams, particularly those that work with reducing parental conflict, because that seems to be where most people seem to have had queries today.
Definitely. Yeah, please do. We'll circulate the slides, and hopefully we can have the email put in the chat also. In that case, I think we're okay to close for today. Thank you so much for joining, and thank you for all of your questions.
Have we got our email addresses there, Huma?
Yes, so we have NCFH inquiries, which is the way you can contact me. And Joe, if we could put your
Shall I put mine in the chat?
Yeah, in the chat, that would be brilliant. Well, we've just had a question from Tracy. Does the work provide opportunities for innovation and testing? I think that's for you, Joe.
So sorry, say that again. Is that in the Q&A?
Yeah. So does the work?
So the work that we've been doing has been all about this, really. It's rather than sort of generically providing support for local areas, it's been about the development of those resources and then testing them with the local areas to see whether they're fit for purpose. And that's why they are all still in beta version, because we're in the middle of doing a big review exercise now, where we're sort of going back. Now we finished this round of work to talk to the local areas that we've worked with the bespoke advice we've provided and the webinars and the tools, the toolkits that we've provided. How can we make that more useful for local areas based on their feedback? So that's when we're going to be going through in the next few months. We'll be going through another exercise until September, where we'll be developing the resources further based on the feedback, so that they've been tested with the 15 local areas and we know that they work then.
Okay, lovely. Thank you so much for your time and your questions. As I said, the links, the slides will be circulated and you have our email. So we look forward to hearing from you.